behalf of the Board of Trustees of the Community Health Endowment, I want to welcome all of you to our annual meeting with the community. We're delighted to have you here today. What a great turnout. I'm Chuck Wilson, and I'm chair of the Community Health Endowment Board of Trustees, and it is my pleasure to serve alongside a very hardworking group of community leaders who make up our board. I'd like to introduce them to you, and the trustees, would you please stand briefly as I recognize you. Dr. Mike Mulbar, who's our vice chair. Okay, yeah. Okay, and Don Hers, secretary of the board. Tom Sullivan, who's treasurer. Tom's with us over here. Okay. Carol Burt, there. Charlotte Burke, up there. Kathy Campbell. Dan Marvin. Kim Russell. Diana Shimmick. Jose Soto, over there. Rusty Vanneman, Rusty's not here. Ellen Weisinger, over here. And then unable to join us today, trustees Kim Moore and Lauren Roberts. I'd also like to introduce our Health Endowment staff, Lori Seibel, who's president and CEO, over here. Marcia White, who's our program manager. And Jody Lose, who's our office manager. Jody. Okay. And also with us today is Corey Oldenhus and Bridget Anderson, who are communication associates who've joined Health Endowment just for the summer. There are also a number of elected officials and other dignitaries here today, including Mayor Chris Beitler, who I've seen right over here. Mayor Beitler, thank you for joining us. I am completing my 6th and final year as a member of the Board of Trustees. I'll be sorry to leave the board, but we have term limits. As a trustee, I've learned a lot about the many individuals and organizations and agencies that are working to make Lincoln a healthier community. And as a trustee, I've had the opportunity to go on a number of our site visits where we go out and actually visit the grant recipients' projects, and have invariably come away from those impressed with the innovation, the passion, and the hard work that these people put into their projects. On page 3 of the annual report, which you should have in front of you, you will see some important facts and figures about the Health Endowment. And Tom Sullivan, our board treasurer, will speak to you in a moment about our investments and our grants. One item of note is that the Health Endowment often funds multi-year grants. That is, some of the grants are for 1 year, but there are some that are for 2 years or even 3 years. For example, in our most recent budget year, there were 23 new grants, but those grants represent 44 years of grant funding. Since our founding in 1998, the Community Health Endowment has awarded 337 grants to 131 different organizations and agencies. That represents 741 years of project funding and a total of $27 million in grants to health-related projects in Lincoln over a period of 19 years. Pretty impressive. Making judgments about grant awards is challenging and time-consuming work, and we're often faced with difficult choices when we look at the funding opportunities that are presented to us. Be assured that we are fully committed to choosing the best options to help Lincoln become the healthiest community in the nation, and that's our goal, to help Lincoln become the healthiest community in the nation. It's now my pleasure to introduce Tom Sullivan, Board Treasurer, who will provide a brief overview of the financial status of the endowment. Tom?
As CHE Treasurer and Chair of the Finance and Investment Committee, I'd like to take just a few minutes to report on the financial condition of our community's health endowment. The Investment and Finance Committee is charged with overseeing the Community Health Endowment portfolio of approximately $62 million. We take our role as stewards of public funds very seriously as we meet, discuss, and strategize throughout the year. As chair of the Investment Committee, I can tell you the most rewarding part of our work is to give the CHE Board of Trustees the opportunity to make grant awards that result in deep and meaningful changes to the health of our community. You will hear about many of these awards today and read about others in our annual report. I would like to draw your attention to page 3 of the annual report. There you will see the impact of CHE to date is about $88 million. That's impressive given the original balance of $37 million in 1999. In addition to the original balance of $37 million, which is retained in perpetuity, CHE has also returned about $27 million to the community. Investments that can be seen throughout Lincoln today. The CHE fund has grown by about $20 million adjusted for inflation. This adjustment assures that the fund is worth today what it was worth in 1999. Finally, CHE acts prudently by maintaining a protection against unexpected market conditions and inflation. For the 12-month period ending March 31st, 2017, our net one-year return was 7.43%. We will continue to watch our investments carefully, act prudently, and maintain our focus to return as much of CHE's resources to the community as possible. It is a pleasure to report that the Board of Trustees increased this year's grant-making budget to $2.25 million, an increase of 12.5% from last year. Thank you for your interest in our work and for helping us pursue our vision of a healthier Lincoln. Thank you.
Good afternoon, everyone. Can you all hear me? Great. Well, thank you so much for being here today. It is an absolute privilege for me to walk into this room and see so many people that I know, a few that I don't, but I am so grateful every one of you are here. I want to offer my own thanks to this tremendous Board of Trustees. Mayor Beitler, you've done some great work in appointing these folks to this board. They work hard and diligently, and I'm so grateful for them, both past and present trustees that are here today. And I'm especially thankful for working with this great staff that are at the Endowment. You know, it has been 2 years since we began sharing the story of Dr. John Snow. And Dr. Snow was the young anesthesiologist who confronted a deadly cholera outbreak in mid-19th century England. Dr. Snow went into London's poor Soho neighborhood, and right there where a violent outbreak of cholera was occurring and it was killing hundreds of people, he walked door to door looking for clues to the outbreak. He walked into the face of a deadly disease that had no known origin and no known cure. And at the heart of his story, right in the middle of all of this is his actual map. Dr. Snow drew on this map as he went from door to door, and he marked every cholera death with a small rectangle. This was important to the people at this time, but nothing was more important than when he stepped back and looked at this map, because in the middle of it, in the heart of that deadly outbreak, he saw a water pump. That map right there led to the discovery between the connection of water to cholera. It was a discovery that changed the course of infectious disease and of medical history. Dr. Snow has been this main figure in our map-making efforts in the last 2 years because he made us ask ourselves a very important question. And that was, if a simple map from 1854 could change the world, then what could maps tell us today about our community, about Lincoln, Nebraska? We know that our original maps that were published 2 years have made a big impact in this community. We know that they have influenced the location of services. We know that they have leveraged funding. We know that they have shaped policy. And now, as we get ready to introduce our updated maps to you, I would like to introduce you briefly to another figure in the story of the cholera outbreak in 1854. And that was the pastor who Dr. Snow asked to accompany him as he walked through that neighborhood of Soho. His name was Reverend Henry Whitehead. Now, Reverend Whitehead was a kind of Anglican missionary, and he was assigned to to serve the slum dwellers in that Soho neighborhood. A typical day of his was spent calling on his parishioners in their homes. It was spent going to the jails, going to the factories, going to the pubs. I hear that he had a special, he especially liked going to visit in the pubs. But according to the map, the ghost map, which was written about this 1854 epidemic, Whitehead had no medical training. He had no background in public health. His only credentials for solving the mystery behind London's most devastating outbreak of disease were his open and probing mind and his intimate knowledge of the community. Whitehead was not an expert. He was not an official or an authority. He was a local. That was his great strength. He was a local. That was his great strength. The reason that he is so important to this story is that he provided something that Dr. Snow could not. That is, he knew the neighborhood, and he knew the people. He understood their conditions, he understood their challenges, their daily routines, he understood their culture. He knew all of these things far better than Dr. Snow did. Dr. Snow may have brought a curious mind, a scientific knowledge to the table, but it was Reverend Whitehead who had trusting relationships with the people there. He knew them. So this was an unlikely duo, a minister and a scientist. But it was together that they worked to save a neighborhood. They brought their own expertise, but together they became placemakers. They became placemakers not simply because they took information and they analyzed it and they put it on a map. That's not what made them placemakers. It was because they did something with that knowledge. They took that knowledge and they put it into action into a way that convinced the policymakers of the time to remove the pump handle, and the epidemic stopped. Think about it. If these two men had never found each other, if they had never developed this unique partnership, if they had never relied on each other's strengths, and if they had not acted on that new and powerful knowledge, we would not be telling their story 150 some years later. So today we get to celebrate some of Lincoln's placemakers. These are people and groups who are using the information from our first set of maps 2 years ago to create change. You will hear about how they're doing that in individual homes and in schools and in neighborhoods. They are using the intimate knowledge of a place as well as their relationships with the people there to do something. They have gone to work on some of Lincoln's toughest health challenges, and I know you're going to love hearing about them. But first, I get to share some of our new maps with you. And I hope that they will inspire more placemakers. Now, as you see these maps, there may be from time to time a sense of saying, what's wrong with Lincoln? But that is not their purpose, and I can't emphasize that enough. It's not about what's wrong. The intent of these maps is to make us informed. They are meant to make us inspired. They are meant to focus us, to create a common understanding of the work that lies ahead. The maps that you'll see are made by map makers, our own community map makers. I get to talk about them, but there are people in this room that did an extraordinary amount of work to make them happen, and I want to briefly introduce you to them. Deb Byrne and Raju Kalakapudi from the Lincoln-Lancaster County Health Department. You guys have to stand for me. Kurt Elder from the Urban Development Department. Vanessa Walonga from Nebraska Extension. Are there folks from Nebraska Extension here? Let's give them applause anyway. I know Joan Anderson from the Lancaster County Medical Society couldn't be with us, but she certainly provided us with some great information. Tom Rauner from the Nebraska Department of Health and Human Services, Bob Rauner from the Partnership for a Healthy Lincoln, and Rob McIntarfer from Lincoln Public Schools. Thank you all for your efforts to make this happen today. So let me get started. I'm going to focus in the brief time that we have together on 3 areas that I think would benefit from robust and strong placemaking efforts in Lincoln. And those are alleviating poverty, healthy children, and planting health in every neighborhood. The first thing I want to talk about is alleviating poverty. We all know that Lincoln has enjoyed tremendous prosperity and strong leadership in recent years, far more than most cities. Yet we're not immune to poverty here. These updated time-lapsed maps from 1980 to 2015 show us that poverty is no longer limited to the core of our city, as some might believe. There's no question that poverty has suburbanized. Poverty in Lincoln or any community, I think, is like the poisoned water in Soho. Think about that. It's often hidden, it's insidious, and it's always moving. As it does, I imagine it chipping away at the very foundation of neighborhoods and of schools and of families. That's why poverty is called the cause of causes, because it's at the root of so many of the challenges that modern cities face. And you're going to see that poverty is intertwined with many of the maps that we'll be talking about today. The bottom line is that we can't expect to address our hardest issues, things like crime or housing or health disparities, if we don't address poverty. To think we can would be short-sighted. So how should we be challenged by these maps today? I think one way is that we have to consider programs that serve people in poverty, and that they were not often built with neighborhoods outside of the core in mind. Their focus has traditionally been concentrated on the very core of a city, much like the 1980 map showed us. So as we look to create new programs and expand existing programs or reframe them, today's safety net programs must consider the type of poverty that has reached beyond the core. That poverty may be more hidden. It may be spread over a larger area. It may be further away from where traditional programs are located. All of us, policymakers, funders, business, education, nonprofits, we all have to reconsider our funding and how we apply it in ways that focus our poverty alleviation dollars not just on the core of a city. I think what these maps do is they provide powerful reminders of how policies and practices have to evolve to see poverty how it really is. So why does a community health endowment think about poverty? The answer to that question is very simple. It's because poverty makes people sick. It doesn't make people sick simply because they have disparities related to health access or services, but it makes people sick simply because of the stress that it puts on minds and bodies. The hardest hit in that equation are often children. This impact is what we now call childhood toxic stress. So that's why we need to talk about creating healthier children, and that's the second area that I believe we have to prioritize in our placemaking efforts. Let's look at this first trimester care map. We know that a healthy baby is directly related to the health of its pregnant mother. And one strong indicator of a healthy pregnant mother is if she receives medical care in the first trimester. This is the first of 3 maps that you will see today that shows there is a lot of work to be done. But one of the reasons the map shows that is because Lincoln has set some incredibly ambitious goals. We can all be proud that Lincoln has set a goal that we want at least 90% of all women to receive first trimester care. Is that a lofty goal? Yes. In fact, this map shows us that today no census tract meets that goal. You know, the federal government assigns designations to areas of a community which is considered to be perhaps at higher risk for poorer outcomes. They call these medically underserved areas, or MUAs. And if I draw a line around the MUA in Lincoln, what you'll see is that there are some of the lowest rates of first trimester care here. That makes sense. But that also means that we need to give this area added attention if we're ever going to reach that 90% goal. It is a lofty goal, no doubt, but I believe it is absolutely possible to achieve. And I'll tell you why. It's because we've done it before. Just think of the impressive work that has been done in Lincoln in the area of childhood obesity. Lincoln is serious about addressing childhood obesity. In fact, our community set a goal in 2010 that we wanted a 10% reduction in childhood obesity among children aged K through 8. We wanted to get to approximately 15%. And you know what? We did that 6 years ahead of schedule. That was a remarkable achievement. That was unheard of in most communities. It was literally swimming against the tide. And you know what? Even better, our community has said we will do even better. And so we've set a new goal, and that is to reduce the percentage of children K through 4th grade who are considered obese to no more than 12.2%. And just like first trimester care, this map reflects that new goal. The yellows, the oranges, the reds, they show us that we have to continue to dig in and address this issue if we are ever going to turn the tide against an epidemic that will reduce a person's life by a decade or more. Addressing childhood obesity must remain a high priority in Lincoln if we expect our children and our grandchildren to live full, healthy, and productive lives. This work is far from over. And as I mentioned earlier, we can't look at these issues in isolation. If we highlight where childhood obesity is greater than that goal of 12.2%, and then we overlay it with the census tracts where poverty is greater than 10%, it's easy to see a correlation. This is just one example of the layering of risk factors that occur that can have such an impact, a negative impact on a child's health especially. One of our most talked about maps from 2 years ago was about life expectancy. This map shows the probable length of time that an individual can be expected to live based on a lifetime residency in a specific census tract. Now, life expectancy is not average age of death, but rather it's a predictor of how risk factors that exist in a neighborhood influences a lifetime of health and safety. It is unlikely that many of us will live our entire lives in the same census tract, but we have to consider the profound impact that these neighborhood conditions can have, especially on children. It is in the youngest years when habits are formed, when stress strikes deepest, when risk factors are often hit the hardest and social connections are created. So the life expectancy in Lincoln is about 80 years. That's about 2 to 3 years longer than across the country. Any life expectancy shorter than 80 on this map means that they are at greater chance of risk factors occurring in this place that can negatively impact a person's longevity. As with the case with our previous map, there is geographic variance of life expectancy in Lincoln, and that variance is most profound from the core of the city to its edge. And in our new map, that variance is about 20 years. Since we released these life expectancy maps 2 years ago, people have asked me, how can that be? How can that be in Lincoln? But Lincoln is not alone in this. These variations in life expectancy exist in cities all across the country. Just a few weeks ago, NPR and other media outlets featured new research from the University of Washington that looked at life expectancy in every county in the U.S. And their findings were very similar to these. So the question is not, how can this be in Lincoln? The question that will make us different and set us aside from other communities is, what can we do about it? Certainly the relationship of poverty is again at play when it comes to life expectancy. And I've often used this map to make the case for the third issue that I'd like to talk about, and that is planting health in every neighborhood. Think about it. What health messages are you exposed to in the areas that you and your family live, that you travel through the most often in Lincoln? What speaks health to you in these places? Do you see physicians' offices and fitness clubs, health food stores? Do you see convenience stores, dollar stores, and fast food? What do the billboards say? What are the visible signs that are telling you that your health is valuable and that it matters? Creating a culture of health in every neighborhood is critical to how each of us forms our choices and our behaviors and our beliefs about health. We have a new and interesting map this year, Healthy Food Access. If you look at the red, the bright red areas on this map, that is where health food availability and vehicle ownership are the lowest. And you'll see the definition of healthy food availability in your map books at your tables. In other words, these are kind of the hot spots in our community where individuals are less likely to be exposed to healthy food and are less likely to have a way to travel outside of their neighborhood to get it. So what happens here? What happens in these neighborhoods? Well, if you look at these side by side, you'll see that where healthy food access is the lowest is quite similar to where poverty and obesity are the highest. These places are ripe for placemaking. I want to give another example. The location of primary medical care also speaks health to a neighborhood. Each dot here represents primary care, either a primary care office, an internal medicine office, or a pediatric practice, anything that's considered a medical home. Lincoln should celebrate the fact that this map looks different than it did 2 years ago, with the addition of 2 new sites in these medically underserved area that's highlighted in yellow. Just imagine what might happen if we continue to work together on planting health in every neighborhood. We can see another triumph of placemaking as is represented by these new clinics. So what happens if health isn't part of a neighborhood's culture? What happens if it's not the message that our children are receiving? Let's look at something like tobacco use. Now, the research is unequivocal. Life expectancy for smokers is at least 10 years less than for non-smokers. And this is important when we think about our young people, that quitting smoking before the age of 40 will reduce your risk of dying from a smoking-related disease by 90%. Lincoln has been on the forefront of policy and programs to address tobacco use, and reductions have been made. And recently, the city set a new goal that's included in this map. It's an ambitious goal, too, to decrease the prevalence of tobacco use to less than 12% by the year 2020. Again, is it a lofty goal? Yes. Do I believe it's achievable? You bet. And this map shows us where tobacco use and primary care are in our community. One part of this effort must be to plant health in these neighborhoods where it's not seen, and send a strong message that the health of each person matters, regardless of where you live. So as I close, I want to return to London. And Dr. Snow and Reverend Whitehead for a moment. We know a great deal about what they did. We don't know as much about why they did it. My guess is that Dr. Snow was motivated by science and that Reverend Whitehead by his faith and relationships. But as I read their story, I couldn't help but think, why did this relationship work? And what can we take away from it to influence and apply in Lincoln today? Well, first of all, I think what this story tells us is that placemakers need courage. It takes guts to knock on the doors, hundreds of doors, in dangerous neighborhoods in the midst of a cholera outbreak. There is no question about that. But you know what? It also takes courage to take on the issues of our day. Things like poverty and infant mortality and childhood obesity. It takes guts to set lofty goals, like Lincoln has done in the areas of first trimester care, childhood obesity, and tobacco use. Secondly, I think placemakers must be willing to go into unfamiliar territory. They have to step outside this comfort zone and expose themselves to people and places that are different, even if it's in this own city, in these 90 square miles that we call home. During the past 2 years, as I've shown these maps to people all over this city, I've always asked the same questions. Now that you've seen them, will you be teachable? Will you be humbled? Will you care? Will you care about neighborhoods where perhaps you don't live? And will you care about generations that you may not live to see? I think placemakers say yes. Snow and Whitehead's story also tells us that placemakers know they don't have all the answers. To be an effective placemaker means a willingness to ask for help, to rely on the expertise of others, and to share any reward or recognition that comes their way, if any. It's safe to say that placemakers are relentless. Dr. Snow was repeatedly rebuffed by the Board of Health when he told them of cholera's connection to the water supply. They were dismissive at every turn, and he went back and back and back again. He could have easily returned to his profession, to his lab, to his research, and left the cholera outbreak for someone else to deal with, but he didn't, and it changed the world. And lastly, and perhaps most importantly, I think placemakers have to be willing to invest in lives that are not their own. Simply put, placemakers have to be willing to do something beyond themselves. So could it really be that simple? I think so. I think it's safe to say that we now know our community better than we ever have. So the question is, what will you do now with what you now know? If we are each resolved to do something, I think we are well on our way to making history. Thank you all so much. And now it is my absolute pleasure to introduce you to our first placemaker, Growing Great Beginnings.
Single-parent families living in poverty are at especially high risk for poor outcomes in many areas of life. Growing Great Beginnings serves Head Start and Early Head Start families through the Community Action Partnership of Lancaster and Saunders counties. Placemaking can happen at home. Since 2013, Growing Great Beginnings has provided in-home education and nutrition coaching and supported family educators working with low-income families. Funded by the Community Health Endowment of Lincoln, the program aims to give children a healthy start by helping families build healthy habits.
A recipe is a starting place. We can modify if we want to.
I think the thing that gives me the greatest sense of satisfaction is seeing families make change. They set goals and and they change. They make it happen. They get empowered. They learn new skills. They see that they can do things that they didn't think that they could do. Makes me feel pretty good. I think it makes them feel even better.
Okay. So with this is a type of knife that is more to go like that.
My name is Sheila Stratton. I'm the nutrition and wellness coach at Community Action's Early Head Start and Head Start programs.
It's gonna make me cry.
It is.
Yeah.
I get to work as part of a program called Growing Great Beginnings. I help parents make the kind of changes that they would like to make with regards to health, healthy feeding, physical activity, those kind of things, so that they can create the kind of environment for their children to get off to a good start and be as healthy as they can be.
So how should I cut them? Like this or like this?
Doesn't matter.
The family education specialists, they're that home, kind of that home link that they're helping families with other goals that they might have to improve their overall lives. So most of the work of Growing Great Beginnings does happen in homes with family educators doing the lessons in homes and with the work I do as a nutrition coach. However, we do offer learning opportunities in a group setting. So we have monthly socializations for families to come. We have parent committee where we're doing some learning together about healthy eating and healthy living, and also in our center offerings as well. We come together and we all want to be a little bit healthier. I think the thing that makes this program work so well is the relationships that not only that I build with participants who I get the pleasure of working with, but our home-based educators see families every week, and they build such trusting, caring, empowering relationships. I think that's what makes it that much more impactful. And it's just been great to see families get empowered and know that they can do what they want to do for their children.
Thank you.
You made soup.
Yeah. This is way better than McDonald's.
And I know some of the folks involved with Growing Great Beginnings are with us today. Would you please stand so we can recognize your great work that gives children a healthy start? Where are you? Folks, one, that's it. Yes, please. Thank you so much. Appreciate it. Well, very good afternoon to you. I'm Jose Soto. For the Spanish impaired, that would be Jose Soto. Thank you. And I'm a member of the Community Health Endowment Board of Trustees. Some of you are wondering, the program says Mike Tavlin. I really would like to be Mike Tavlin. I am not. He was called out of town for a funeral, so our condolences are with him, and this gives me the privilege of recognizing this year's recipient of the Michael J. Tavlin Leadership Award, and that's my task today. This recognition is presented to an individual who has provided extraordinary board service to a local nonprofit organization. Along with this recognition, CHE will also award a stipend of $1,000 to the nominating organization to be used for board training and education. In the images on the screen before the meeting, we highlighted the names of 23 other persons who were nominated for this award. Each of them represents the passion and commitment and leadership that make Lincoln's nonprofit community strong and vibrant. If any of the nominees for this award and their nominators are in attendance today, would you please stand so that we can thank you for your leadership, your contributions, and your dedication to creating a stronger and healthier community. Some of those nominees are here. Oh, please rise. Don't be shy. No need to be shy. Obviously, with the caliber of individuals who were nominated, a very difficult decision. Not only am I on the Community Health Endowment Board, I also have the privilege and honor of serving on the Board of Directors of the Malone Community Center. I've had the privilege of working with this year's recipient on that board for several years, as well as on many other boards and community activities over the past 30 years. He is a colleague, a friend, and a mentor of sorts. Today, I am honored to present this year's Leadership Award to Mr. Thomas Christie. Thomas is the president of the Board of Directors of the Malone Community Center, and he was nominated by Larry Williams, the executive director of the Malone Center. Unfortunately for us, this meeting coincides with the 23rd Annual Multicultural Leadership Institute for Lincoln Public Schools that Thomas initiated and has chaired since its inception. So while we're honoring Thomas, he is working with more than 1,200 educators to learn more about working together for inclusion, equity, and excellence. That's the theme of that conference, but it could also be the theme of Thomas's leadership at the Malone Community Center. Thomas has served as president of the Malone Community Center Board of Directors for the last 5 years and served as a member of the board for several years before that. He's also been a member and beneficiary of the Malone Community Center since his arrival to Lincoln decades ago. Under Thomas's leadership, Malone has taken on some big projects: the establishment of an early childhood education center and the replacement of an aging heating, ventilation, and air conditioning system. Certainly, one of those efforts sounds a lot more fun than the other, but Thomas approached both with determination and enthusiasm. And he took on what most board members don't like to do, and that's making sure that the funds were raised to complete both projects. Needless to say, leadership counts when exciting new projects are ahead. It counts just as much, and sometimes even more, when an organization experiences challenges. And when the Malone Center recently faced a difficult challenge, Thomas took an affirmative leadership role in establishing communication and addressing head-on with staff, parents, and other community stakeholders that were impacted by the challenge. He rose to the challenge. Now, before I can finalize here, I'd like to ask Larry to say a few words about Thomas, since he was the one who nominated him. Larry.
I didn't know this was a speechy meeting. But what I would like to say is that, it's no secret that we've had some challenges over the years at the Malone Community Center. But I think with Thomas's leadership, we have been able to weather the storm, to continue to move forward, and to be in a position where that we can move forward and look towards the future. I could not find a better person that has been a mentor to me, not only that, but a friend, and also what I would say a spiritual brother, which I think is an important part of everyone's life and should be acknowledged. With that said, I'm pleased to take this award back to Thomas. I'm grateful to the Community Health Endowment for this award. I don't think we could find a person in our community who is better qualified, suited, and has been a tremendous asset to Lincoln Public Schools and our community at large for well over 30 years. This is well deserved for his commitment to excellence, to service in our community, and to making everyone live to their greatest potential. Thank you so much.
I'm not quite ready to turn over the award quite yet, but here it is. You have to wait. And thank you for the remarks, and I agree wholeheartedly. And please take some time to read about Thomas's accomplishments and contributions to Lincoln in the program. And just when Lori and Marcia were taking a big sigh of relief, Jose is staying on script. He starts, following the persistence and insistence of Dr. Snow, in taking a point of personal privilege to briefly share with you something that you won't read in the program. It's a concern that Thomas and I often talk about, and to be quite honest with you, worries us considerably. That is the assault on human and civil rights that we're experiencing in this country, in this state, and even this community. It's an assault and attacks that are coordinated, well-funded, and designed, in my opinion, to erode the progress we have made in ensuring that everyone is able to enjoy the rights, benefits, privileges, and opportunities related to education, health care, which would include women's reproductive rights and health care, and access to justice and economic security. And these are issues that disproportionately impact communities of color. And the connection to today's agenda is that, like poverty, racism, sexism, and exclusion make people sick. Says here, Jose, go back on script. In doing just so, it is my distinct honor and my sincere pleasure to present this leadership award to Mr. Thomas Christie, along with a $1,000 stipend to the Malone Community Center in his honor. Since we are videotaping this meeting, Thomas will be able to see and hear your recognition for his service. So please join me in thanking him with an applause. And I think the next thing that is on my script is to introduce the Feet First video, another placemaker. Thank you.
Obesity and the diseases that come with it can take years off a person's life. Lincoln Parks and Recreation became a placemaker when they started running a program for kids in a neighborhood with one of the highest rates of childhood obesity in the city. Feet First offers coaching, team spirit, and a new pair of shoes donated by the Lincoln Running Company. As important as improved mile times, Feet First inspires confidence and discipline in youth, qualities that will serve them in running and in life.
Feet First is a program that helps kids prepare for their future, to inspire them, to motivate them to do better, not just in running, but in their day-to-day lives, pushing themselves in the classroom or in other interactions. My name is Cody Hoagland, and I'm a coach for Feet First. Well, I do feel like I'm making a difference in what I'm doing. I really enjoy what I'm doing. When I talk about my work, I do talk about Feet First, and I'll brag about what my kids are doing and how they're improving. I feel like it's a very amazing program.
That Feet First helps you run more faster. It's fun. It's good for you. When I get faster, I feel like I get stronger.
My name is Mary Johnson. I am the Learning Center Supervisor at F Street Community Center. At the beginning of the session, we have them fill out a self-efficacy survey, and then we have them fill it out again at the end, and we look at the difference in the questions. And what we've seen is a marked improvement, that they have a better sense of being able to approach their world, tackle problems, and make new friends, and everything that falls under that umbrella. And the most exciting part for the kids is we get them a new pair of shoes.
Some of the slower kids I like to help out, making them feel to push themselves. I support them by cheering them on. It makes me feel good because I'm helping other people.
Willis is pretty popular with the other kids. He's just really likable. Just since day one, he's always put in 100%, and he's always been ready to go, and he's always had a positive attitude. And whether he's singing while he's running or just trying to motivate other people to keep going and pushing themselves, helping other people get motivated, and he's going to go on to do big things.
We've had kids that have been very shy and timid become more outgoing. I see it happen. I see kids' faces light up. I see them start to say, well, I ran this mile. Maybe I can run too. It gives them an identity to connect with. They identify themselves as a runner, and they take a lot of pride in that.
1, 2, 3, feet first.
I believe we have some people from Feet First sitting here. Would you stand and be recognized for your good work? Good afternoon. I'm Carol Burt with the Community Health Endowment. It's my privilege to introduce this year's recipient of the Closing the Gap Award, Lincoln Parks and Recreation. I'd like to ask Lynn Johnson, the Director for Lincoln Parks and Recreation, to come on up here with me. That's when we dance. The Closing the Gap Award recognizes individuals and groups doing important work in Lincoln to reduce health disparities and eliminate barriers to health care. Today marks the 12th time that CHE will honor a person or a program working to reduce inequalities in health, what Dr. Martin Luther King calls, quote, the greatest form of injustice, unquote. Many people and agencies are working to close the gap. CHE witnesses the work of these people every day in many ways. We know it takes desire and persistence. Lincoln Parks and Recreation came to our attention this year because of Feet First. But their history of service and commitment to the whole community goes back decades. Whether it's maintaining the miles of bike trails that crisscross the city, or the parks located in every quadrant, Lincoln Parks and Recreation plants health in Lincoln every day. Sometimes that planting is very literal with trees and flowers that enrich our environment, and sometimes it is planting the means of reaching people of all ages and ability with innovative programs. CHE has partnered with Lincoln Parks and Rec not only on the Feet First program, easy to say, but also on the Rocksteady Boxing program, which operates out of the Air Park Rec Center and serves people with Parkinson's disease. With Woods Tennis Center recent expansion, CHE also supported the tennis center's Taking the Game to the Community program, which provides free tennis racket and low-cost lessons at rec centers, parks, and schools across the city. There's more information about the accomplishment of Lincoln Parks and Recreation in your printed program. Even then, it captures only part of the dedication and compassion that Lincoln Parks and Recs gives every day across our community. On behalf of CHE, we offer a public thank you to the Lincoln Parks and Recreation for their action, vision, and commitment to a healthier Lincoln. And I'd like to introduce Lynn Johnson right now.
Carol, thank you very much. It is a great pleasure to be here this afternoon. And on behalf of the Parks and Recreation team, I want to say how humbled we are and how honored we are and how grateful we are for this award. I think probably everybody in this room knows that there is a significant overlap between Parks and Recreation and public health in influencing the health of residents, both their health and the wellness of community residents. I want to thank the staff of Parks and Recreation for their creativity and their enthusiasm for meeting people where they're at, both physically and mentally, to improve their health condition through engaging recreation programs and facilities. We believe that one of the greatest opportunities that we have anyway to impact health in this community is through positive, engaging, intentional recreation activities and facilities. I also want to thank our many, many community partners who help us in this important work. We could not do what we do without the many, many agencies and organizations and people who we have the opportunity to partner with. Thank you all for this opportunity, and we thank you very much for this award.
I am pleased to introduce our next placemaker profile, Health 360.
Access to healthcare is a key part of overall health. With the creation of the Health 360 campus, Lincoln has made great progress in planning health in some of Lincoln's most medically underserved neighborhoods. As a placemaker, Health 360 offers a broad array of integrated services in one convenient location. Clients walk in through the same front door with vastly different needs and leave equally served. Here are two stories of Health 360 serving the whole person for better health.
This is probably the best doctor that I've had. I switched my OB to here too, because at first it was just Zion's doctor, and I didn't know that I could go there too, so I was like, I might as well join with her team, and her doctor is pregnant too, so it's like, we clicked.
My name is Shanika, and my family goes to Health 360, and my daughter attends Head Start.
I think in the long run, I'm a lot better off understanding my diagnosis. And before I came here, I really didn't understand the things that were going on.
My name's Chris, and I'm a client of Health 360.
So I guess I'd say, if you're looking for a long-term doctor or a doctor for you and your children, then come to 360. She's always happy to see the doctors. And they're really good with children. And they don't just try to give you some medicine and get you out quickly. Like, they really see what's wrong. You know? I was like, there's probably the place for us to go.
So now I understand those diagnoses, which kind of takes a little bit of the fear and the anxiety away from me. And having the counselors and the med manager and the caseworker and my doctor all help me understand. So my life is beginning to make sense.
Well, out of like the daycares, she learns something new every day. She's always excited to come back here. I want to see my friends. So it makes me feel safer in mind. I don't be worried all day long, because I know they're taking care of her. So. The thing I like best about the staff is the personal connections that they have with each and every one of the families. I think they kind of go a little bit further individually to make sure that we're all okay with the kids and that the kids are okay here and at home. And then they offer a lot of like community programs where we can get to know the other parents, so we can bring the kids together. I like some of the little groups that they have just for parent information, etc. So they're pretty awesome.
They explain, the med manager explains the medications I'm on and why I'm on them and what they do and the side effects of them. Matter of fact, my doctor prescribed a medicine that I had a side effect. I developed a bad cough. Well, I called them. I had immediate care. They knew who I was, and they do whatever it takes. They've gone over backward to try to help me. You know, my counselor understands when to push, when not to push. My med manager understands, you know, what I'm going through, and my doctor. I mean, there's nothing I can't share with these folks because they're friends. You can't find a better place.
Good afternoon. I'm Dr. Michael Mulvar, Vice Chair of the CHE Board of Trustees. In the video we just saw, you learned about some of the programs offered on the Health 360 campus: primary medical care, behavioral health services, medication management, and quality child care. There are even more services available on the campus that really bring the name 360 alive. 360 means wrapping a broad array of services around a person to give them the best chance at a healthy life. The extraordinary collaboration that makes all of this possible is the reason that the entire Health 360 community is the recipient of this year's Horizon Award. I'd like to ask representatives of the following organizations to join me on stage for the presentation of this award: Lutheran Family Services, People's Health Center, Legal Aid of Nebraska, Community Action Partnership of Lancaster and Saunders Counties, Community Crops, the Genoa QOL Pharmacy, I hope I pronounced that correctly, the Bridge Behavioral Health, and the Lincoln Lancaster County Health Department. Today marks the 17th year CHE presents the Horizon Award at our annual meeting. The Horizon Award was created to recognize the contributions of people and organizations working to make Lincoln a healthier community, often without expectations of recognition, but looking to the future with their eyes on the horizon, hence the name. Certainly, as these agency representatives sat through dozens of meetings, read hundreds of emails, and signed scores of pages of agreements, they weren't thinking about standing on this stage and receiving this award. They were more likely thinking about the people they serve and how they could work together to serve more of these people better. Most of us recognize the mind-body connection and understand how integrating treatment for physical health issues and mental health issues can improve the ultimate outcome. But if your landlord refuses to get rid of the mold in your apartment, or you need a protection order because of an abusive relationship, legal issues become health issues. If you lose your job and can't go to school because you can't find quality, reliable daycare, child care issues become health issues. If you can't afford healthy food or don't live near a store that offers it, food access issues become health issues. Each of the agencies represented here brings a piece to the puzzle. When all of the pieces are in place, our community creates a vibrant picture of health beyond health care and a brighter future for many of our most vulnerable residents. There's more information about the Health 360 community in your printed program, and I encourage you to read that and to thank this group of agencies for their vision, their tenacity, and their willingness to stay the course of integration at all the name Better Health for Every Person. And with that, this is for all of you. But all curious.
Good afternoon. My name is Kim Russell. I'm the president and CEO of Bryan Health. And it seems particularly fitting for Bryan to host this meeting today because of the history of Community Health Endowment. I'm guessing some people in the room, but maybe not everyone, is aware that the initial funding for Community Health Endowment came from when Bryan Memorial purchased the former Lincoln General Hospital from the city of Lincoln, the hospital that we now refer to as Bryan West. And so seeing all of the good works that has come from the endowment over the years since that transaction in the late 90s, it's just what a wonderful investment in our community. I'm very privileged to serve on the Community Health Endowment Board, and the word that always comes to my mind as I think about CHE's works is the word catalyst. I think Community Health Endowment truly serves as a catalyst for change and health progress in our community. And you know, what better statement could you make about the importance of the organization? I hope everyone has learned today about just some of the wonderful things that are happening in our community as a result of CHE serving as that catalyst. As we conclude our program and as you leave, please be sure to take the 2017 book with you. And I really want to point out the very last page, the call to action. You know, so often we come to meetings and run to our next thing. Please take a look and read this and think about what can you do as a result of what you have learned today? Think about Lori's maps, her presentations. What can you bring back to your workplace or other organizations with which you interface? That's really our objective, is a call to action for the entire community. Please also remember that the presentation that Lori gave today, you can request that presentation just by contacting the Community Health Endowment Office to be repeated by Lori at any organization or group that you're involved in. Lori definitely takes this one on the road. She customizes it to the group, and we'd love to get this information out even more to the community. So feel free to contact the CHE office. So thank you all so much for joining us today, and safe travels home. Thank you.